back to Vagina Talk. As you know, this is our podcast, Vagina Talk by Doctors Kimble. I'm Dr. David Kimble. This is Dr. Alexis May Kimble, my lovely wife. We designed Vagina Talk as a means of specifically talking about the vagina. I know, I said it, vagina. Do you remember our most recent reel on our Instagram account, Doctors Kimble and Kimble? Tell us about that.
So in our home, vagina is not a bad word. We told our son that, and he says it commonly. So we thought to share that on Vagina Appreciation Day, and it kind of went viral. And we kind of want that sort of energy to be disseminated every day, all day throughout the year.
Yeah, because, we talk about the taboo topics and we talk about all the kind of misunderstanding, the myths that are out there, all related to the vagina, things between the legs, womanhood, females, people identify as females in general. So today we have a pretty exciting podcast and episode here. We're going to talk about not just us as surgeons or our attendees and invitees, which are anesthesiologists, but about the patient experience. What do they go through? All of us work in the OR every day, right? This is home to us. We're comfortable there, super comfortable. But as a patient, it's foreign. Frankly, it's just scary. So anybody who's scheduled for surgery, has a family member, a neighbor, a coworker who needs to have surgery, listen up. This is a great podcast for you. So I would like to introduce our two anesthesiologists. Let me say premier anesthesiologists.
Our esteemed anesthesiologist.
Both of which are from Huntington Memorial Hospital in Pasadena, California. Dr. Jonathan Maskin is the Director of Surgical Operations, and we have Dr. Phillip, who is the Chief of Anesthesiology. So let's jump in, guys.
Okay, well, good afternoon. It's it's very flattering of you to invite Phillip and myself to be with you, and we're very honored.
It's a pleasure to be here, and just want to say vagina is not a bad word in our house either. 8-year-old or 10-year-old, they use that word like it's anything else. So
Good. That's good.
I'm with you guys.
Yes, one child at a time. So the first thing I want to say is, when we're high volume surgeons, urogynecologists, and we operate mostly at Huntington Hospital. And in preparation for our patients, we see them for multiple visits. We order multiple diagnostics to optimize our patients for surgery. Part of this is that we make that pack so patients feel really 110% ready before they go into surgery with us. As part of this process, we have them go to Huntington Hospital. So what can they expect, Dr. Maskin, when they go there in preparation or in advance of their surgery?
Okay, so you're talking about our preoperative, the preoperative aspects of it. Okay, so, well, we have a lady who's in charge of the preoperative clinic, and her name is Dr. Amy Kim. She is a Mass General trained anesthesiologist, and one of the people I'm most proud of that I hired. So she oversees the whole preoperative clinic. The idea of the preoperative clinic is, firstly, to try and see if there's anything hidden in the patient's history or physical examination or laboratories, including cardiograms, x-rays, that might warn us that they need more medical workup, that they need to have something else done that might mitigate the risk of the upcoming surgery. So that's the first thing. The second purpose of the visit, I don't know, we don't have to argue which one is more important, is to try and give the patient the first opportunity to ask questions about the upcoming surgery, which they've had a lot of opportunity with your team, but of our team in terms of what what it's going to look like on the day of surgery. And I think part of that too is to open up their thought process on the questions they might ask of the anesthesiologist on the day. I think everybody's very scared. And so if they get a first, if they run through these thought processes first in the pre-op clinic, when it comes to the chance to speak to the anesthesiologist, I think they're less likely to be so terrified and overwhelmed by the occasion that they can genuinely ask the questions that they need to get answered prior to surgery. But of course, let's not put down the medical side of it. I think it's very important that everybody, when they go into surgery, is in an optimal condition.
Absolutely. So labs, discussion with the nursing staff there, kind of get an overview of, when do I arrive? What do I do the day before? What do I do the night of? Where do I go that morning? All those kind of factors, logistics that come into play that kind of create this heightened anxiety.
Yeah,
So that's good. That's great to know.
I think so. And I think one of the things they take away from that for patients is to recognize it's really for their best interest and the benefit of the patient, and really the whole team, just so everyone's on the same page. Sometimes patients are like, why do I have to go to all these appointments and go here, go there? Why do I have to get these labs? I'm a healthy person. But I think it's really important just for that reassurance that really this is to optimize them and make sure that everyone on their team on the day of surgery is prepared and ready. So I think that's
So one other thing perhaps to add to that is the fact that if there's anything that's of real concern, they will see an anesthesiologist during that first visit. Secondly, the all of the members who see them at the preoperative clinic are in direct contact with us. So we have an anesthesiologist that's free at all times, not free, but available at all times during the day, who's managing the overall operating room. That anesthesiologist can be contacted. So imagine there's something that is out of the ordinary on the electrocardiogram, that we can, the electrocardiogram gets faxed over to this anesthesiologist. He looks at it and says, it's probably safer for this lady to go and speak to a cardiologist. Or he says, we see this all the time. I don't think it's anything to be concerned about. So
good
Absolutely.
point. Definitely.
Yeah, before we get too much deeper into this, I'm sure a question in our audience's mind is, what is an anesthesiologist? Dr. Lau, do you want to comment to that?
So the anesthesiologist truly is what we call kind of the perioperative physician. And we want to take care of the patient and get the patient through the entire operative experience. And one way to kind of think of it, I almost think of it as we are the primary care physician for that patient during the operating experience. And so we do everything from calming them down in the preoperative area, meeting them, introducing us to them, and just answering all the questions that they may have. I think a lot of times when we encounter patients, they tell us they're more afraid of the anesthetic than they are of having the surgery. And so we're there to allay those fears, explain to them what they're going to do. And then when we take them to the operating room, and beyond putting them to sleep, they always say, oh, you're the one that's going to put me to sleep. I say, well, actually what I get paid for is to wake you up. And
It's true.
yeah. And so, we're there with them the whole time. And while we do give them the medication to put them to sleep, we don't just give that and then leave the room. We're with the patient the entire time. And as the patient is undergoing the surgery, when we put them to sleep, we're not just putting their brain to sleep. We're putting essentially the body's ability to maintain its own adaptability to its environment to sleep as well. And so we are there to monitor the heart, the breathing, their temperature, everything. And it's our job to maintain all those life-sustaining duties of the body, and we assume that control, and we're there to make sure that they wake up and they wake up comfortably. We have measures in place to titrate pain medicine in while they're asleep, so we kind of have a good feeling of how much they will need to wake up comfortably. We have means with different injections and different type of procedures that we can do ourselves as anesthesiologists to ensure that when a patient wakes up, they're going to be comfortable. And if they're not immediately 100% comfortable, we're there now to get them through the post-operative experience as well. So we're there kind of as their primary care physician, watching over them preoperatively, intraoperatively, and postoperatively to make sure that they have the most relaxing and comfortable experience as they possibly can.
I think that's really well said, so that people can understand sort of the comprehensive process. And it can't be emphasized enough that, some of the patients are like, well, I'm asleep. Like, how can they know if I'm in pain? And why is that important? But for patients, like we see a lot of chronic pelvic pain patients or chronic pain patients. And we say that really controlling your pain during anesthesia or surgery actually is really important to sort of mitigating or exacerbating some of these underlying conditions our patients already have. So, it's a real team effort in terms of ensuring that all their needs are really cared for, and even when they're asleep and they might not even be entirely conscious of it, what they're feeling.
Yeah, that's right. Even though they are unconscious, the body still reacts and still feels the pain, because the pain is is controlled sometimes not at the level of the brain, but at the level of the spinal cord too. And so even though the brain's asleep, the spinal cord is still feeling what's happening to the body, and we can see that through our monitors. And so then we can react intraoperatively to make sure that the patient will be comfortable.
It's a really important relationship between the patient, anesthesiologist, and the surgeon all throughout.
Absolutely.
We have to be fine and in tune with each other.
So can I follow that up just a little bit? So two things. You get that question a lot, is how will you know if I'm in pain? And there are a lot of standard things that we do. We always have an EKG on the patient, an electrocardiogram, which tells us A, if the heart is well, and B, if the patient is reacting. If the patient, even though the patient is asleep, their heart rate will go up if they're reacting to anything. We have a blood pressure cuff on the patient at all times, or an even more advanced method of following the patient's blood pressure. So once again, if anything changes in terms of pain stimulus, you can tell that immediately, even though the patient's not saying that to you. On the patient's finger, you have a little monitor that tells you how much oxygen is in their blood at all times. As most people will remember, oxygen in, carbon dioxide out. We have a little monitor on the patient that shows us the amount of carbon dioxide that the patient is producing. And this not only tells you that the patient is breathing, it also indirectly gives you some idea of the patient's heart function. On the patient's forehead, we use a monitor called a BIS monitor, bispectral analysis. It's essentially an EEG monitor. Takes the patient's certain of the patient's EEG waves, throws them into a mathematical formula on the computer that we are using, comes out with a number that correlates quite nicely with how deeply the patient is anesthetized. So all of these monitors talk to us, even though the patient is asleep. So we know if the patient is feeling something because the anesthetic may not be as deep as it could be, or if they're too deep. And then we adjust accordingly, kind of like when you drive a car. You give more gas, you give less gas, and you respond to stimuli that way.
So in essence, even though the patient's physically asleep, they're actually still talking to you. right, through various methodologies that you have and advanced technologies, that you monitor them. So you're able to kind of listen to what they're saying to you, which I think will hopefully kind of ease some of the fears that
Mhm.
patients have about, being under anesthesia.
Right.
They're like, oh, I'm like, gone, and they have to bring me back, and they just don't understand the intricacies of it. So that's super helpful. I appreciate that immensely.
Yeah.
And I think circling back a little bit to the team is paramount, right? It's not a one-man show, it's not a one-woman show. So you got to have the right team. And that's why we really feel very indebted partly to Huntington Memorial Hospital, because they've really kind of captured and designed a phenomenal team, from the nurses to the rest of the staff to the scrub techs to our anesthesiologists. And, as very high volume surgeons, that's what we need. That's what we're looking for, the best patient experience. So,
There's so many steps that go into a successful surgical experience. There are thousands, and there's so many people involved that contribute to that. And I don't think that can be emphasized enough.
so what would you
So can I,
oh, I'm-
sorry, can I jump in here again? I'm sorry to do that. So I want to say something about the two of you. Okay, and I'm going to say that to hopefully this is going to some of your prospective and current patients. Okay, amongst the nursing staff at the hospital, okay, Dr. Tran and Dr. Kimble they know the names of the people who bring the patients into the room. They know the name of the person we have a person who assists us with anesthesia, known as an anesthesia tech. They're actually certified. They have to do exams and they have to do training. They know the names of every single one of them. They know the names of the technicians that are assisting them, and they also know the names well of the nurses. It makes a huge difference. We work with a lot of surgeons. Not all surgeons know that. And that speaks to me of the fact that they're humble and that they're also aware of the fact that the ultimate level of care they're going to get for their patients depends on how well that team functions. Now, just to give an example, sometimes you come upon something unexpected in surgery. It happens no matter how well you're prepared, no matter how well Dr. Kimble and Dr. Tran and Dr. Kimble prepare for the surgery, no matter how well Dr. Lau and me have the patient worked up. When something untoward, unexpected happens in surgery, either the anesthesiologist or the surgeon is going to be very preoccupied with what's going on with the patient. And the team, who is always important, then becomes even more important, because they've got to act either autonomously or in conjunction with me or Dr. Lau, while Dr. Tran and Dr. Kimble are busy actually doing a particularly difficult, complicated, unexpected aspect of the surgery. And it's so important that the right equipment is there, that everybody just moves seamlessly to help them take care of whatever issue they've come upon, or to help us. And the fact that they are as humble and aware of the team as they are is one of the reasons why they get the types of outcomes that they do. And I say this with complete sincerity, because not every surgeon knows the level. And when you two leave the operating room, on multiple occasions, the team has said to me, we really like working with these two. They're so nice to us. We want to be in this room. And ultimately, that is always going to affect patient outcome. And I say this with complete sincerity. So
yes. Thank you,
We
Dr. Maskin. That
appreciate
is very
that.
kind.
no, I'm being very, very sincere when I say that. I don't know if I'm jumping on the question. Dr. Lau, Phillip is also Mass General trained, which is the best residency training program in the whole of the United States. One of his particular interests is nerve blocks. Phillip, you want to tell Dr. Tran and Dr. Kimble's patients just a little bit about nerve blocks, why you like them, and what may come up with their surgical processes?
Yeah, well, I think that's one of the methods we have in assuring that patients wake up comfortably, and one of the modalities that we have in addition to pharmacological or medications that we can use. And so, nerve blocks are injections into the body where we deposit a a bank of local anesthetic, uh, and a lot of times we can use what we call a liposomal local anesthetic, which is kind of a slow releasing type of local anesthetic, and we essentially bathe nerves that innervate or give the sensation to the certain parts of the body that we want to target. And by bathing these nerves with this local anesthetic, we can essentially render those nerves not as um, active to sense that pain. And so we can target the specific body parts and minimize the pain sensation from those body parts. And therefore, we can minimize the amount of opioids, which is something that will only give benefit to the patient. And so it's an important aspect of managing patients' pain that I don't feel is utilized largely enough. But fortunately, we do have that ability and that skill set at the hospital.
It's made a huge difference for our patients. A lot of them don't even use opioids after surgery. They use like a Motrin or a Tylenol. And most of our patients, if they do use opioids for any of our surgeries, it doesn't go on for more than like 2 or 3 days. So I do think it makes a huge difference.
Yeah, and we've worked in hospitals from Mass General to Chicago to NYU to Princeton University to Albany Medical Center, here at Huntington Hospital, and others. And all ORs are not created equal. All anesthesiologists are not created equal, nor are all surgeons created equal. So I think there's a big difference between the various hospitals throughout the country. And when all those various pieces together for safety, for improved outcomes of the patient, for comfort and experience of the patient, then we've created probably the utopia for surgery, in essence.
Yeah.
Now, would you two comment differently on maybe something else that's a bit more unique, or what you think is like the coolest thing about being in the OR and what's the least enjoyable?
Well, Philip, why don't you be a little, or you go, you run with this. You run with this.
Well, it being in the OR, every day you take it for granted. What a true honor and privilege it is to be in that experience with these patients, because these patients are trusting you with their life, and not just their life at that moment, but their life moving forward and how that will be. And so that is just it's truly an honor to be uh, to have a job where you can make such a big difference and have such a profound impact on patients' lives. And I truly consider that an honor, and that kind of is the best part of the job. There are days when I leave the hospital and I think to myself, wow, I can't believe I got paid to do that, because it just felt like such an honor and a pleasure to be there and to make actual palpable differences in people's lives. And to me, I think that is the most enjoyable part. And it makes the day, it's like the icing on the cake when you can work with great collegial people such as yourselves.
Yeah, well spoken, very well.
Really true.
So I can't let this one go by completely.
Okay.
So back to my colleague, Dr. Lau. Okay. Dr. Tran and Dr. Kimble, and I'm saying this to the patient, Dr. Tran and Dr. Kimble said all surgeons, all hospitals, all anesthesiologists are not created equally. Okay. That's absolutely true. There's no question that we talked about nerve blocks. There's no question that to have nerve blocks versus not having nerve blocks, is not equal. But also, not all nerve blocks are created equally. And Dr. Lau has pioneered several of the newer nerve blocks. And nerve blocks have been around for maybe 10, 15 years. And the thing that made the difference to them is that we got a more sophisticated ultrasound. The cost of ultrasound became a lot cheaper, so that we could have ultrasounds in almost every room, and with them came the science of nerve blocks. But there are several new nerve blocks that we do, that Dr. Lau has pioneered at Huntington, that are more effective than the older ones. So why is that important? Well, it's always nice. I mean, patient satisfaction is very important, and it's very important that we provide the best level of pain control that we can for you if you're about to have a prospective surgery. But some of the patients are older. Some of the patients have other medical conditions. High blood pressure is very common in the older patient population, diabetes, heart disease. All of those conditions put the patient at more risk for things like for conditions like blood clots and chest infections. Dr. Tran and Dr. Kimble are operating in the pelvic area. In the pelvic area, there tends to be a certain amount of blood that gets dammed there as they operate in that area. If a patient has less pain post-operatively, they're more inclined to take a deeper breath in, whereas if they're hurting, they tend to sit still and not take deep breaths in. The more they take those deep breaths in, the more they suck that blood out of the pelvic area, the less likely the patient is to have a blood clot, the less likely they are to have a post-operative chest infection. Those are the reasons why we send patients to the preoperative clinic. And of course, the older the patient, the more at risk they are. So comfort is important. Customer satisfaction is important, but there's a lot more that's in play than just that. The more effective the nerve block, the more effective the nerve block, the more attention to detail that's paid with planning the procedure and clearly thinking what the best nerve block is for this particular procedure, what the best level of pain control. The more the patient will breathe post-operatively, the less likely they are to have one of the complications that really we do everything in our power to stay away from because. So.
Absolutely. Totally agree. It's for us, it's always been a privilege and honor to work with you too in the OR. I think we've gathered a really good relationship. I mean, that's very important as, surgeons to have anesthesiologists that we trust. So as kind of a final closure here to our podcast, any comments that you would make to the audience about, what are the really most important thing to consider before going to the OR? What is like the top thing to be able to ease their concerns?
Or how would they choose where to have their surgery and with whom? What are some things they should consider? Some take home points.
Well, I truly think the most important decision for a patient to make preoperatively is picking the right surgeon. Because when you pick the right surgeon, then you have everything else can fall into place, because the surgeon will then pick the right hospital and will have the right team working with them. And how do you pick the right surgeon? You have to really you have to meet the surgeon, take a look at their track record and the amount of cases they do, what kind of cases they focus on. And that is truly important. You can't just look at Yelp reviews and Google stars, because there's so many bots out there just creating fictitious reviews and fictitious scores, and so you really have to take a look at the data that matters regarding your surgeon, such as what do they truly specialize in. You don't want to go have vaginal rejuvenation surgery with someone who does that once in a while or dabbles in it. You really want to make sure you have someone who specializes in it, has a does it day in day out, and I mean whatever procedure you're going to have, you want to make sure you find a surgeon that specializes in that, and not one that just it's they do that case a couple times a month or something like that. So I think truly, it is about finding the right surgeon, and with the right surgeon, then all the other pieces will fall into place for that one patient.
So too.
Yeah, I totally agree with you, Dr. Lau. Dr. Maskin, any last comment that you'd like to make?
Yeah, I actually wanted to, my comment's a question to the two of you, to Dr. Tran and Dr. Kimble. Dr. Tran and Dr. And I was hoping that the patients are listening very clearly to me here. Just as an interesting question, one of the specific surgeries that Dr. Tran and Dr. Kimble do involves a device called the robot, okay, which is I'm sure they'll deal with that on another day. But the one thing about a robot is it minimizes the amount of pain. But it's actually quite complex and it's difficult. How many have you guys done?
Yeah, today, well, including what we've done at Huntington Memorial Hospital, I'd say
No. How many have you guys done? It doesn't matter about
Oh.
Huntington. That's not specific to Huntington.
2,400,
Okay, how many?
2,400 or so.
Okay, and how many surgeons have done that many?
Handful.
If that.
Yeah.
Okay, these two have done more robots than anybody else. There's got to be a reason. It can't just be good fortune. So just a thought in reference to what Dr. Lau said. And the other thing is, by the way, one of the other considerations that a lot of patients have is post-operative nausea. And again, the more back to Dr. Lau's nerve blocks, I mean, everything that we're doing today is to reduce the amount of pain the patient has, because it increases the safety of surgery. The less opioids, I think the patients all hear about opioids on television and on radio. It's a huge problem in the country, and but the less opioids a patient uses, the less likely they are to be nauseous, to have nausea after surgery.
Absolutely.
And even though nausea doesn't kill you, it is so unpleasant. And so the things that Dr. Lau alluded to about nerve blocks and planning pain medicine reduces the likelihood of nausea, reduces the severity of it. The last thing I want to say, I know I've spoken too much, is that at Huntington, we do a lot of cardiac surgery. We do a lot of heart surgery. So most of the time, most of the patients that Dr. Tran and Dr. Kimble work on are not super high risk. They're not patients who have, most of them have not had 2 heart attacks. They don't have unstable angina. They don't have the things that are really get an anesthesiologist super duper attention. However, if we get into a situation where something out of the ordinary happens, we always have an anesthesiologist that is free, and we can always get access to as an example, a cardiac anesthesiologist who, if we got into something untoward, we could do the most sophisticated tests and monitoring in the operating room within 5 or 10 minutes, regardless of who the actual anesthesiologist is who's doing the surgery. So this adds another level of safety to the procedure. This doesn't happen often, but it doesn't happen often because they have all of these pre-op testing. But I do think that it is something to consider, that when you come to Huntington, when you have these two do your surgery, they are very aware of the team that's backing them, and they treat them well. And when they are needed, everybody drops what they're doing. It comes to the assistance of that patient. Thank you.
Thank you, gentlemen. Unfortunately, we're out of time. We'd love to continue this for another hour or so, but we are truly out of time. So we can wrap this up.
Yeah. Thank you both for sharing your thoughts, sharing your perspectives, helping our patients understand more about the Huntington Memorial Surgical experience with us and with our team at Huntington. And it's always a pleasure to see you both and speak with you. And it was kind of nice all to get to the nitty gritty in a patient kind of perspective, so they can understand a little bit more about some of the requirements involved in this process.
So maybe our patients coming up this week for surgery will say, I saw your podcast.
Actually, 10 questions why
Yes,
you have to draw my
exactly.
blood.
There you go.
Right. Or why do they still wear nail polish for the monitoring of the
No, it's better now. It's still
Yeah,
better.
yeah.
It's better. Occasionally you have to take the nail polish off. Occasionally, but not often anymore.
okay.
We have ways
I'm-
around it now.
I'm
Good.
old enough to remember when we used to have,
for them.
I'm old enough to remember when we used to always have to do it. Thanks to the two of you for inviting us on the show. And most of all, thank you for coming to Huntington. You've really added another dimension to our care. And I think you've helped up the level of care, not just in your own room, but around the whole operating room. So thank you.
Absolutely true. And it's the community is much better having you guys here, helping us and serving a very important service line for the community. So thank you guys.
It's an honor and
Yeah.
privilege.
It's true. All right, gentlemen.
All right.
Thank you. See you this week.
Time with us.
Bye.
Thank you so much for listening to Vagina Talk podcast. If you want to learn more, you can find us on our web, www.kimblecenterforpelvicwellness.com. See you next time.
Bye.